Another triumph for us both, eh, Flynn? Might have a coffee sachet in here somewhere we could share. What's this?
It's that letter Sid gave you earlier.
Oh, God. Oh, no.
What?
2 urgent referrals to our waiting list. My star's fading fast. Come on, we have no time to lose.
We?
Grab the list, Flynn.
I can walk. I can walk.
Right, what's the first referral?
It's from a GP. Mr. Hudson Park's aortic aneurysm has a 90% chance of rupture within 4 weeks.
Was the letter dated?
3 months ago.
Oh, Sid. Is that Mrs. Hudson Parks? Hello, I'm calling on behalf of Mr. Ron, consultant surgeon at the South Mid. Yeah, I understand your husband is on our waiting list for urgent surgery. Really? Yes, that is a terrible tragedy. I'm so sorry for your sad loss. Goodbye. Result! 1 down, 1 to go. The next. Come on.
Oh dear, this one may not be so easy, Dr. Noble. Could be a big operation. We haven't even got a bed. There mightn't be a free slot in theatre. The patient hasn't had his pre-op workup.
Enough, Flynn.
It's an official referral from the intensive care unit.
What?
A large mole on the chest. It is an imperfection. It must be removed.
Gas man. You're coming with me, Flynn.
Still looks like the patient's in the corridor.
Not a corridor, Mr. Ron.
A ward.
Officially opened as of now.
Oh, well done, sister. Not sure about the name, though.
Noble and Flynn, welcome to my world. Out of the way with your stick of feathers.
You want us to operate urgently on Mr. Thompson.
Thompson? What's that?
Patient? One of those warm pink things you attach the tubes and machines to?
No, still not with you.
Hospital number SM6578.
Ah, SM6578. Why didn't you say? The skin blemish bed 4.
Quick summary, please, Gasman.
PA TBP 120 over 70, PO 289, PCO 245.
No, why is he actually here in ICU?
Ah.
3 days post-myocardial infarction in the right-sided heart failure and a compromised renal function. He's been on a ventilator for 2 days.
Thank you, that's enough. Get back to your cleaning. It is very complicated. You surgeons would not understand.
And why is this mole so urgent?
It is an imperfection and it must be removed.
So how long has he had it?
First noticed 1845 hours last night. No previous record of it in the notes. There must be a very aggressive melanoma to grow at such a rate. Could be very painful in the future.
Melanoma? I'll never get that sorted out by tomorrow morning.
Oh dear, oh my.
Right, let's take a look, shall we?
It was his birthday yesterday.
Okay. What do you see, Flynn?
2 centimetre diameter discoid lesion, dark brown, variegated in colour, irregular surface with a well-demarcated, slightly raised edge.
Gasman, would I be right in thinking his relatives had a little birthday party for him last night?
Yes.
And did they bring any party food with them at all?
Yes.
If I may just examine the lesion. Pepperoni, I believe. Very tasty. Intensive care unit, the human buffet. And I, Flynn, have just earned my star.
Right, I'm off.
You going anywhere special tonight?
No, why?
Not off on a date?
No, just the bingo.
Oh, right. Well, you'll need a pen then.
That's a rectal thermometer.
Julie, have you a minute?
Is it important?
It's about Mrs. Portland. I'm sorry I took the credit for your idea of putting the maggots on that foul, fetid pussy ulcer of hers. And those maggots were really rancid, too. I mean, the stench. They must have been really hungry or they would have started to chomp into that ulcer. You're not eating that. I mean, of course it was your idea and everything.
Yes.
You couldn't have Mr. Ron believing it was all thought up by just a nurse.
No.
So is there anything I can do to show my gratitude?
No.
No. Well, thanks for the crispy...
Actually, some flowers would be nice. Some red roses.
Red roses, sure. And maybe I could take you for a meal sometime, if you're not busy. And which you probably are, because you have lots of friends here, unlike me. Boyfriends even. Again, unlike me, haven't got a boyfriend.
Tonight.
What?
Let's go out tonight. Meet me at 8 o'clock at the hospital entrance. Oh, but don't forget. Red roses.
Florist!
I just so wanted to thank you personally for what you did for my husband.
Before he succumbed to his illness.
Yes. God bless you, Doctor. God bless you.
We do try our best, Mrs. Howard. And I can't tell you how tasty those Thornton's hazelnut and caramel moments were. And you really shouldn't have brought me these wonderful flowers.
Sid? Sid? All right, Doc. Been here long? An hour. I should have been here at 8. I dashed as fast as I could, see? Was Sister Hope here then? Sister Hope? Didn't see her. Oh. What's with her flowers? They're for a patient. Here he is.
Thank you.
Why you got flowers, Dr. Flynn? Oh, they're for the, same patient.
Thank you.
You haven't seen, Staff Nurse Judy, have you? Doing a late shift. Ah, right. Mustache.
Mr. Ron?
Evening, Noble.
Hello, boys. One at a time.
Where is Sister?
Oh, sorry, I'm late. I was up all night.
Right. Well, the inspector will be here in 10 minutes. That waiting list still sorted, Noble?
Yes, sir. Once I get my teeth into something.
Yes. And the new Ron ward is up and running, which just leaves your bed blocker, Flint. Let's go and see if those maggots have finally devoured all of that dead flesh once and for all, shall we?
Mrs. Portland, I'm afraid you're going to have to stay in here just a little bit longer.
Flint!
In this dirty old part of the city where the sun refused to shine, people tell me there ain't no use in trying. We gotta get out of this place. If it's the last thing we ever do, we gotta get out of this place. Girl, that's a better life for me and you.
All right, Doc. Not often I see you at this late hour, Sid.
But word is we're due for a dawn raid from the old bill tomorrow.
Police? What they're looking for?
Certain illegal substances, you know. Things you naughty doctors shouldn't be holding on to.
Joints.
Joints.
Arms, legs, spleens, any human tissue. They're cracking down unless you've got written consent for storage.
Really?
See this? The hospital pathologist found it down the back of the mortuary freezer. Could have been there for years. He's asked me to hide the evidence. I must dash before it falls out. It's starting to drip already.
No, Sid.
Oh, don't catch me unawares like that, Dr. Noble. My heart's beating like a drum. Boom. Boom. Boom.
What's with Sid?
Boom.
He seems really agitated.
There's going to be a police raid tomorrow.
Police raid? Whoa!
Are you all right, Dr. Noble?
Pure adrenaline, Flynn. It's the buzz from this place.
Have you been drinking?
No.
Coffee?
Might have, possibly. I can handle it, really, I can handle it.
Just coffee?
Sure, only coffee, nothing else, no other stimulants. Red Bull. There's a whole stash of it in the mess fridge. I couldn't resist. Come on, we've got to get to the ward. It's a medical emergency.
Emergency?
Yeah, I've got the munchies. Flynn, I need some of the nurses' jollies. Observe, a master in action. Sister, how are things? All quiet in the struggle against disease and suffering?
Been a bad day, Dr. Noble. Look at that. Only one box of Cadbury's roses given to my nurses all day. Get your greedy hands off my nurses' chocolates.
Oh, please, let him have just one.
I bet neither of you washed your hands after you saw your last patient. Go and wash your hands now, Flynn. The sink is over there.
Sister, would I be correct in thinking that that is the sink with the scalding hot water and no cold tap?
You better believe it.
Cold water, hands burning, pain searing.
Still in that jug.
And while you're there, can you check it for glucose? Is Mrs. Farrell's urine sample?
Oh, what?
No chuckies until you've both washed your hands.
If you give Noble a chocolate, I'll tell you a big secret.
Go on.
Well, there's going to be a police raid tomorrow looking for retained body parts.
Oh, we already knew that. The hospital pathologist called to warn me just before he went into hiding.
Why?
He knows about these earrings.
Brown pearls?
Gallstones. I took them when I was a student.
Oh, well, you leave those with me, sister. I'll hide them. Could be very risky, though, what with the police.
What's your price?
Chocolates for Noble.
Deal. 2 earrings, 2 chocolates.
Flynn, take me to my chill-out room.
Night, night, boys.
Now, at last, I get some sleep. Oh. Bleeping Flynn. Local GP, put him on. Hi, Dr. Flynn, on-call surgeon. Non-specific abdo pain. Sure, send her to casualty, I'll see her. In the meantime, I'll just put up a drape, squeeze in a couple of units of Hemocell. No, I'm not taking the piss. Well, what emergency equipment have you got? A tongue depressor? Oh, just hold a hand till the ambulance comes. Night. Thank you, God. Now I'm going to be up all night sorting her out. Right, I need coffee. Oh, no coffee. What would Noble do? Aha, Red Bull.
Ah! I thought you were the police.
You're the hospital pathologist. You can't hide in here.
Why not? It's nice and chilly. I'm used to it. I spend my life in cool, ambient temperatures.
Whatever. Where's the Red Bull? Thanks.
Hey, who turned the light off?
Flynn. Again, put him on. What is it now? Has she? Well, that's very sad. No, I'm sure you did all you could with your tongue depressor. Good night. And I won't be needing you! Yes, 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 yes! One of my patients just died.
Sorry, sir.
Thank you. What time is it?
9 o'clock, sir.
This is supposed to be a dawn raid.
I'm sorry, sir. My alarm didn't go off.
Come on, we've got a lot to do.
All right, cops.
I've always had toes ever since I was a little baby.
Really?
I think my fingers arrived when I started nursery.
Did they? Right, that's your nails all clipped. Just a moment.
Miss Alison Bradley, State Registered Chiropodist.
Yes?
D.I. Crichton, CID. May I ask exactly what is in that silver kidney-shaped bowl?
Bits of nail, corns, callus.
Human tissue?
No. Well, yes, I suppose so.
Right. Bring her in.
Same time next week, dear.
Morning. Oh dear, you two look terrible.
Slight hangover, Terry. Mixed my drinks last night.
I heard. You all right, Dr. Flynn? You look a bit melancholy.
I did something last night I'm not very proud of.
You should have bleached me. I could have joined in.
No. This GP rang about an admission, and I just really wanted to get some kip. So when he rang back to say this woman had died, I felt really happy. Happy this poor woman had died.
And then you did a shameful thing?
Oh, don't stop moping, Flynn. Keep a professional distance like gas man. You don't get emotionally involved with patients, do you?
No, it's too painful. For them?
Now, Staff, that's a different story, eh, Dr. Flynn? You can't beat a nice doctor-nurse romance. We're both off duty tonight, aren't we?
Are we?
I think you're pushing at a closed door there, Terence.
It's always the back entrance, Dr. Noble.
Flynn, we're here to care for patients, not about them.
I got over-involved with a patient once. The romance ended in tears. I was working in the Clap clinic at the time. He was a very good-looking soldier.
How did it end?
With a dishonourable discharge.
I'd nothing to do with it.
Just put the arrow point, genuine screw, curved blade, cuticle scissors down, and no one's going to get hurt.
Why, Docs?
Not same stiff as last night, sir?
No, this one's 100% legit. Brought in dead to casualty last night. Here, look. Choked on a tongue depressor.
Where did you hide the other one?
In the hospital lift. Till the heat's off.
The lift, but people use that all day.
Not anymore.
Listen, Sid, you couldn't help me out with these, could you?
Well, you have been a naughty boy, Dr. Flynn. They look like gallstones. Yeah, two very nice bile pigment stones. That's calcium bilirubate, as well you know. You want me to torch them?
No, just hide them for a while. They belong to Sister Hope.
Sister Hope? I'll sort it.
Right, let's look at this week's admission list. Varicose veins, hernia... Oh, hello, here's one for you. Frank Briggs, peripheral vascular disease, due for a leg amputation. If you can be emotionally detached around him, then you've cracked it.
Why? Is he everybody's favourite patient? I bet all the nurses fuss over him.
No, he's a shit. Right nasty piece of work. Terrifies everybody.
Why would I get emotionally involved with him?
Fear is an emotion too, Flynn. Show no fear.
Don't worry. I'll be the consummate professional. Excuse me. Hello, Mr. Briggs.
Oh, please don't kill me, I'm your doctor!
Easy, lads. Sorry, Doctor.
Thank you.
The boys are a bit nervous. There's old Bill knocking about all over the place.
Yes. Well, I really should examine you alone. But if you'd like your friends to stay, that's fine. Right, if I could have a quick look.
Mr. Briggs gets very nervous about people touching him down below. Ever since the distressing incident in the Feltham Young Offenders Unit.
Perhaps we could just skip the physical examination.
Thank you, Doctor. That'll be all.
Yes, well, that's all I needed.
You are doing a wonderful job, Doctor. My old mum used to be a nurse. She loved the NHS, she did, and that is why I won't go private, out of respect for her. She was Irish. Flynn's an Irish name, isn't it?
Yes.
I think you and I are going to get along fine, don't you? Friends like.
Friends? Yes.
Good. Because when something hurts a friend, it hurts you. Comprehende? If things go wrong for me, they go wrong for you as well.
Well, nothing will go wrong. Mr. Ron hasn't killed anybody recently.
Missed. Missed. You're just making it worse for yourself.
You'll never take me alive.
Let's not be hasty.
I've a Westbury square handle single spring concave nipper, and I'm not afraid to use it.
No. We'll head her off using the lifts. Never mind, she won't get far. Where's next on the list?
Chiropody department, surgical ward, sperm bank.
This is a police emergency. Take me to the sperm bank.
We could just go to the toilets.
Dr. Noble, what kind of things could go wrong for, say, Briggs' surgery tomorrow?
Go wrong? Oh, well, let's start with the minor local things. Hemorrhage, primary, reactionary or secondary, infection, strictures, sinus formation, adhesions, abscesses.
Oh, it's the only way to get rid of it. Come on, girls, it's full of protein.
Stroke, heart attack, parotitis, lung collapse, cuddly toy, pulmonary embolus, and finally bed sores. I make that 56 possible complications. Why do you ask?
No reason. Look, if anything happens to Briggs, he's going to hold me responsible just because we're friends.
Friends? Flynn, what did I tell you about getting involved?
Well, he probably doesn't mean it.
Yeah. Flynn, can you swim?
Yes.
With concrete around your feet?
No.
Too late.
Sister Hope?
Who wants to know?
D.I. Crichton, CID.
I don't know nothing. I haven't seen no earrings. Who grasped me up? It's a lie.
I've come to see an old friend, Mr. Frank Briggs.
Briggs. Oh, yes. Bed 6.
From all the lads down at the station, well, that is kind.
The governor asked me to pass on his personal regards. Here's a little gift, too.
Cigar, lovely.
Sir, the chiropodist has been spotted on the hospital roof.
Oh, sorry. Duty calls.
I will tell your boss I'll be paying him in euros from now on.
Let's not be hasty. We can work this out.
I'm not a criminal!
Let me try, Gov.
Patience, lad. Softly, softly, catchy monkey.
Monkey? What monkey? Where's the monkey?
Come on, you two. Out you get. Visiting time is over. Your boss needs a good rest tonight. He's got a big operation tomorrow.
Go on, lads, off you go. Come and see me tomorrow after the operation. Go on.
Now hand it over. Not that the cigar. If you didn't smoke these things, you wouldn't be needing your operation tomorrow.
I like you, sister. You got bottle.
Yes, I have. And now it's time for you to fill it.
Please let me try, Gov. We've been up here for hours.
Okay.
Go on, then. Jump, you cruel, heartless freak.
Why did you say that?
Reverse psychology.
Right. Well, I think we're done here. Fancy a curry?
Yeah.
You bleeped me, Nurse Judy?
Yes, Mr. Hunter's urinary catheter needs replacing.
No problem.
So, how did you get on with Mr. Briggs earlier? Did he scare you?
Me? Of course not. In fact, we got on very well. Friends, almost.
Really?
Yes, I'm a doctor. The criminal classes respect that. So this catheter, what bed's Mr. Hunter in?
Bed 6.
Right, bed 6.
Or was it bed 5?
What do you think you're doing?
Oh, Mr. Briggs!
Is this what you do? Touch patients up when they're asleep?
Oh, no! And you still are.
Still a what?
Still asleep. This is a lucid dream. You're still asleep.
Yeah, you're right. Is that you, Mummy?
Yes, dearest.
A bad dream, Mummy. The bogeyman.
Oh, don't worry, dear. Mummy's here. Go to sleep, my baby. Close your pretty eyes.
I love you, Mummy.
I love you too, Francis.
Kiss and cuddle.
Yeah. Kiss and cuddle.
Oh, how lovely, Dr. Flynn. You two have made friends.
Gasman, I know this may seem a strange request, but could you please make sure that Briggs doesn't feel any pain?
That is my job, Flynn.
I know, it's just after the last case.
The patient's screams were just a reflex contraction of the vocal cords and lungs.
Yes, I just don't want anything to go wrong.
Oh, stop blabbing, Flint. You're a bag of nerves. Can we just get on with the amputation, please? Flint, you haven't marked this patient's leg.
Well, I couldn't. Wouldn't let me touch him down there, sir.
Good God, you're a doctor. You can touch people any way you bloody well want. Now, which side are we operating on?
Side?
The left leg or the right leg?
Oh, it isn't written